As your partner in the future of medicine, Vertisis Custom Pharmacy is happy to provide guidance in the use and administration of some medications. In this video, we will provide a step-by-step guide on how to self-administer an intramuscular injection. An IM, or intramuscular, injection is a shot that delivers medication straight into your vascular muscles, allowing them to take faster effect than sublingual, digestive, or even skin-absorptive delivery. On a human body, there are 4 main sites that are considered safe and effective for IM injection administration: the upper arm, the deltoid muscle; the hip, the ventrogluteal muscle; the thigh, the vastus lateralis muscle; or the buttocks, the dorsal gluteal muscle. For self-administration, the thigh, vastus lateralis, is typically used because of its ease of access. Before beginning, it is important to make sure that you have gathered all necessary supplies. These will include hand sanitizer or soap and water, alcohol swabs, 2x2 gauze pads, a new needle and syringe sized accordingly, your medications, disposable gloves, and a needle disposal container. Now it's time to check your syringe and needle. A syringe consists of 3 parts: the needle, the component that pierces the skin and inserts into the muscle; the barrel, the chamber that holds and measures the medication; and the plunger, the component that controls administration of medication. The needle size will vary depending on the size of the patient, the IM injection site, and the medication to be used. Be sure to check the needle gauge and length. The gauge refers to the diameter of the needle. The larger the gauge number, the smaller the diameter will be. The length is measured in inches and is typically dependent on the size of the adult. It is important to dispose of your syringes and needles correctly. Needles and syringes should not be thrown in general trash, are not recyclable, and are subject to state laws regarding proper disposal. You may receive or need to purchase a hard plastic container made specifically for used syringes and needles. In a pinch, you can use a soda bottle or some other plastic bottle with a screw-top lid. Once you've gathered all your materials, it's time to choose an injection site. When trying to determine the most suitable injection site, you need to consider both the ease of access and the volume of medication you intend to inject. Some sites cannot handle large volumes, while others may be more prone to skin trauma. The best site to perform an IM injection when you are alone is the thigh, since it's the easiest to access and see. It also has the capacity to handle larger needle sizes. However, it's always a good idea to switch up the injection sites to prevent any skin irritation and scarring. Keep a log of where on the body you last administered an injection, with date and time. It is now time to begin application of your IM injection medications. Wash and dry your hands thoroughly before handling the injection supplies. Don't use a syringe that's been previously opened, used, or damaged. Always use the exact dose that you have been prescribed. Don't allow the needle to touch anything other than the medication vial. Some medicines will require reconstitution prior to use. Always follow the instructions provided by the pharmacy and/or your medical professional. Seek professional advice if you're unsure about any step. Choose your injection site and clean the chosen injection site with an alcohol swab. Remove the cap from the medicine vial and clean the rubber stopper with an alcohol swab. Check the package containing the syringe. If open or damaged, discard and choose another. Remove the cover from the syringe. Pull back on the plunger to draw air into the syringe. You want to pull back to the same volume as the dosage of medication you will be using. With the vial on a flat surface, insert the needle in the rubber center and push the plunger to expel the air into the vial. With the needle still in the vial, turn it upside down. Ensure the needle tip remains covered by the liquid in the vial. While holding the vial upside down, pull back on the plunger to draw the liquid into the syringe, ensuring you draw the correct dose. Check for air bubbles by tapping the side of the syringe. Depress the plunger slightly to expel any air. Double check you have the right dose of liquid in the syringe, then remove the needle from the vial. Choose your injection site. and insert the needle at a 90-degree angle. Without withdrawing the needle, slowly and slightly draw it back to ensure you haven't pierced the blood vessel. If blood is visible, discard the needle and begin again in a new location with a fresh needle. If no blood is visible, continue to inject the medication slowly until it's all administered. Apply pressure to the injection site for a short period of time with gauze. Needles and syringes should not be thrown in the general trash, are not recyclable, and are subject to state laws regarding proper disposal. Be sure to dispose of your needles and syringes appropriately. We hope that this video has been helpful. As always, please check with your healthcare provider before administering any medications. If you have any questions about this video or any Vertisis products, give us a call at 1-888-285-5841 or visit us at www.vertisis.com. Vertisis Custom Pharmacy, your partner in the future of medicine.